Welcome to Changing a OnePiece Pouching System, a topic from the video series WEB WOC's Ostomy Procedures and Techniques. This is sponsored by an unrestricted educational grant from Hollister Incorporated and lectured today by me, Bonnie Sue Rolstad. Using ostomy equipment properly is an important skill to master, and it increases the nurse and patient's comfort level with performing ostomy cares. A OnePiece pouching system, both fecal, which you can see in this picture, and urinary, have broad application in ostomy care and are among the easiest to use. A OnePiece pouching system includes a pouch and a skin barrier. They are applied together and removed together. They can be drainable for fecal stomas or urostomy for urinary diversion stomas. These OnePiece pouches may be cut to fit so that the same type of pouching system can be used as a stoma changes its size by cutting the skin barrier to the size of the stoma. Those pouches are seen on your left. Or they may be pre-sized, which is on your right, where no cutting is needed and the opening on the pouching size cannot be changed. These OnePiece pouching systems can also be available in flat or convex with different types of skin barrier formulations. There are lots of choices here. Yes, there are numerous pouching systems available in the OnePiece pouching system. So when do we as nurses change a pouching system? That may be one of your first questions. It may also be one of the questions your patient may have also. So let's talk about that. Drainable pouching systems are to be emptied when they're a third to a half full. If that does not happen and the pouch overfills, leakage may result. Additionally, leakage may result from a pouch that is in need of a refitting. Whatever the cause, leakage signals an urgent need for a pouch change. Taping leaking pouches is damaging to peristomal skin and not considered to be best practice. Preferably, the drainable pouching system is changed on a schedule, usually in the morning before the patient has anything to eat or drink. This means that you have less effluent coming from the stoma during a pouch change so that you have less to clean up. The schedule may be every 3 or 4 days, but the important point is to avoid leakage and patient embarrassment. So you can also see what the patient's schedule has been in the past if they've had one. Let's review how you would change a OnePiece pouch. Many times your patient can be involved in part or all of the steps as you are teaching self-care also. If the patient has transferred from another setting, ostomy pouch change procedure and frequency for pouch change is usually located in the transfer orders, or it's in the teaching folder or the ostomy supply package. So there are 3 basic sources where you can look for that procedure. First, you will want to assemble supplies. You will need the following items: the new pouch, stoma measuring guide, a pen and a pair of scissors if it's a cut-to-fit pouch, a disposable bag for your used pouch, water, and some soft tissues or paper towels for washing and drying the skin. If accessory items are being used in this procedure, assemble those at this time also. After the supplies are assembled, you're ready to prepare the new pouching system. If a cut-to-fit skin barrier is being used, draw the pattern of the stoma onto the backing of the skin barrier. To avoid cutting the pouch with the tip of the scissors, use a curved blade on the scissors if possible, and pull the pouch material slightly away. The skin barrier is then cut out. The fingertips may be used also to smooth the inside edge of the skin barrier after it is cut out. The bottom of the pouch is then closed with the closure device, or the spout of a urinary pouch is turned in the off position. Remove the paper backing from the skin barrier adhesive and set it aside for now with the adhesive side facing up. Save the paper backing on the skin barrier as your next pattern for the pouch change. Date the pattern and throw away any old patterns. If you are using a pre-sized pouching system, just peel off the paper backing as it's already ready to be used, set aside with adhesive side facing up. You will then want to empty the pouch prior to removal. As nurses, we all know how to remove adhesives. We use adhesives a great deal. Use those same techniques when removing a pouching system. To review them, when removing the pouching system and adhesive, be cautious and support the skin. Adhesive removal can be non-traumatically done by lifting the edge of the adhesive and peeling downward. Then you gently support the skin by pushing it away from the adhesive barrier. Dispose of the used pouch, and if a reusable clamp is in use, save it. Clean the skin with water and, if needed, a skin cleanser. Do not use oils, powder, lotions, or lotion-type soaps on the skin. Rinse and dry the skin prior to applying the new pouching system. If you are using any accessory items such as additional skin barrier products, now is the time to apply them. You'll want to wick away any stool or urine that may emit from the stoma as you are doing the procedure. You can use a soft tissue or a paper towel. It is important, however, to keep in mind that the skin needs to be clean and dry prior to application of the new pouching system. As you apply the new pouching system, it is centered over the stoma. You will want to teach the patient this as well. As the pouch is applied, a gentle pressure is applied to ensure a good contact with the skin and the adhesive. Begin next to the stoma and work out toward the edges. Place your hand or the patient's hand over the barrier and hold it in place for 30 to 60 seconds. The warmth of your hands and gentle pressure will help to activate the adhesive. Finally, if there's a border of tape, remove it at this time and continue to gently press the tape down against the skin. The patient is encouraged to keep an emergency kit with them so that the items needed for a pouch change are available in the kit when the patient is away from home. As a bedside nurse, you play an important role in the rehabilitation of your patient. The basic skill of changing a pouching system is important to master as part of the patient's skill set. Teaching patients and/or families how to care for the stoma is essential to their recovery and return to routine activities in their lives.